Hello, my name is Scarlett Gonzalez, and today we'll be going over function of the knee. What does the knee do? The knee is our largest joint in the body. It is also our most weight-bearing joint. The tibia is the most weight-bearing bone. The knee is needed for walking, running, cycling, squatting. It is needed for our everyday living. In this section, we are going to be going over the knee structure. There are 2 joints in the knee, 3 bones, 7 ligaments, 2 menisci, and many muscles. The first joint within the knee is the patellofemoral joint. The patella tracks in the trochlear groove of the femur. It stays in place with the lateral and medial retinaculum, as well as the medial and lateral patellofemoral ligaments. The patella tracks in the groove in a type of pulley system. The next joint we're going to go into is the genu joint, the knee. It is between the tibia and the femur. It is a hinge joint, and its motions include flexion, extension, and some minimal rotation. The first bone we're going to cover within this section is the femur. The femur has many landmarks, but we are only going to cover the distal landmarks. We have the medial epicondyle, the lateral epicondyle, lateral condyle, medial condyle, popliteal surface, intercondylar fossa, trochlear groove for the patella. As seen in the picture to the right, you can see the medial epicondyles are in the middle, the lateral epicondyles are on the side. To the farthest right, you can see the intercondylar fossa. To the farthest left, you can see the trochlear surface very clearly. The next 2 bones we cover is the patella and the fibula. I didn't include the fibula in the count of the bones, of the knee bones, because it doesn't articulate with the femur or the patella, but it still needs to be talked about. The patella is the largest sesamoid bone in the body. A sesamoid bone is a floating bone. It sits within the trochlear groove of the femur, as we've gone over, and the fibula is a smaller lateral bone in anatomical position, and it is an attachment point of ligaments. The final bone is the tibia. The tibia has many landmarks just like the femur, but in this one we will only be covering the proximal end. The landmarks on the proximal end include the intercondylar eminence, the tibial plateau, the medial condyle, lateral condyle, tibial tuberosity, and the pes anserine. In the picture to the right, the tibial plateau is not labeled, but it is above the tibial tuberosity. Everything else is clearly labeled. The tibia is a main weight-bearing bone. It is always on the medial side of the leg in anatomical position, and it articulates proximally with the femur. Now that we've gone over the bones, let's go over the articulations, or the ligaments that hold these bones together. To start off, we have ACL, PCL, MCL, LCL, capsular ligaments, arcuate popliteal ligament, oblique popliteal ligament, and 2 menisci, lateral and medial. First, we're going to start off with our interarticular ligaments. We only have 2. Interarticular means it is between the 2 bones. First, we have the anterior cruciate ligament. This ligament begins on the anterior tibia and goes diagonally backwards to the lateral femoral condyle. This prevents tibia from moving anteriorly to the femur and limits medial rotation. Many athletes tear their ACL and have to get it repaired. The posterior cruciate ligament is next. This ligament begins on the posterior tibia and goes diagonally forward to the medial femoral condyle. This prevents the tibia from moving posteriorly to the femur and limits lateral rotation. Oftentimes, athletes can tear their posterior cruciate ligament, but it is not as easily repaired. Now let's move into the extra-articular ligaments of the knee. We have 5. To start off, we'll start with the medial collateral ligament. This is the picture farthest to the left. There are 2 portions of this band-shaped ligament on the medial side of the knee. The superficial portion goes from the medial epicondyle to the tibia. The deep portion splits off from the superficial and goes underneath capsular ligament to attach meniscus. If you look very closely to the picture on the farthest left, you can see that in the middle of the superficial portion, it splits off and goes into the deep portion. The MCL provides medial stability to the knee. Next, we have the lateral collateral ligament, a cord-type ligament on the lateral side of the knee that goes from the lateral epicondyle to the fibula. It provides lateral knee stability. To continue on to the rest, first we have the capsular ligament, a ligament that surrounds the knee. Next, we have the arcuate popliteal ligament, a ligament on the posterior side that runs vertically off the fibula head. On the picture to the left, you can see the fibula head to the right, and then the arcuate ligament runs vertically. The oblique popliteal ligament is also on the posterior side and runs at a diagonal. There's only one ligament that you can clearly see that runs at a diagonal, and that is the oblique popliteal. The rest of the ligament surrounding the joint is the capsular ligament. Now that we've covered ligaments and bones, let's move into the menisci. The menisci is a tough cartilage that acts as a shock absorber between our two bones. There's the medial and the lateral meniscus. The medial meniscus looks more like a C. It is the one farthest to the right, and the lateral meniscus looks more like an O. It's almost closed off, and that is farthest to the left. As you can tell, I forgot to put a picture on this slide, but we will be covering the muscles. The muscles produce the motions of the knee, including flexion, extension, and some rotation. The quads and hamstrings are the ones we will cover the most. Let's get into the quads. We have 4 main quad muscles: the rectus femoris, the vastus medialis, vastus lateralis, and vastus intermedius. Rectus femoris is the big muscle in the middle, and it does hip flexion and knee extension. Vastus medialis is the teardrop muscle on the medial side that does knee extension and proper patella tracking. In an injury, not even an injury, during surgery, ACL surgery or meniscus surgery, it is the first muscle to go and the hardest to come back. The vastus lateralis is the most lateral muscle of the knee and does knee extension. Vastus intermedius is the deepest of the 4, unable to see here on this picture, but it also does knee extension. Next, we have the hamstrings. The hamstrings are our deceleration muscles. We have 3. First is the bicep femoris, which does knee flexion and hip extension. In the bicep femoris, we actually have a long head and a short head. Next is the semitendinosus, which also does knee flexion and hip extension, and the semimembranosus does knee flexion and hip extension as well. This is our last section of muscles. To start off, we have the gracilis, which does hip abduction, hip internal and external rotation, and knee extension. The sartorius is next with hip flexion, hip abduction, knee flexion. This muscle allows us to do the figure 4 muscle with our leg. Tensor fasciae lata, the muscle isn't really used, but the IT band that runs off the TFL is important to the knee. The gastroc does knee flexion and plantar flexion of the ankle. In today's PowerPoint, we learned the 2 joints of the knee, the bony landmarks of the femur and the tibia, how the ligaments are used for stability, and the actions the muscles have on the knee. That is the end of my lecture. Thank you for listening.